Inflammation is the reaction of living tissues to all forms of injury. Advantage and disadvantage of inflammation. It is a protective response. It tends to destroy the invading microorganism. It tries to inactivate the toxins. It helps in healing repair. It helps in clearing infections. It may be potentially harmful in some condition, example, viral encephalitis. The healthy tissues can be damaged if a healing process fails due to continuous inflammation. Types of inflammation. There are two types of inflammation. Number 1, acute inflammation. Number 2, chronic inflammation. Acute inflammation. It is the immediate and early response of the body to injury. Chronic inflammation. It is the prolonged response of the body tissue to the injurious agents that are persistent. Acute inflammation. It is the immediate and early response of the body to injury. Characteristics of acute inflammation. This inflammation will be for a short time and usually lasting from a few minutes up to a few days. There will be the formation of exudates and chemotaxis. There will be the collection of neutrophils and leukocytes. There will be complete recovery. Changes in acute inflammation. There are two types of changes occur in acute inflammation: vascular changes, cellular changes. Vascular changes. First, vasoconstriction occur in response to acute injury. It occurs in small blood vessels. After this vasodilation rapidly occurs, change in blood flow which increase in blood velocity due to dilation of the vessel. It purpose to increase vascular permeability. Fluid is lost from the blood and the blood velocity and the blood viscosity is increased that slows down blood flow. Increased vascular permeability and fluid exudation in capillaries and venules. As a result, widening of intracellular junction which allows passage of large amount of fluid which produce tissue swelling called edema. From the dilated vessels, WBC come out and engulf the bacteria or toxins and tissue debris. Chemical substances which are responsible for reaction come out and activate like histamine, serotonin, prostaglandin, bradykinin, leukotriene, complement systems. Enzymatic digestion of tissue and debris occur. Finally, restoration of injured tissue comes to its normal structure and function. Cellular change. The following are cellular events in acute inflammation. Migration. In this process, the inflammatory cells try to localize in the outer margin of blood flow near to the vascular endothelium. Adhesion. In this process, the inflammatory cells attach to the endothelial cells. It is due to the presence of adhesion molecules on the surface of both cells. Immigration. In this process, the attached inflammatory cells leave the blood vessels through the intracellular junction. Chemotaxis. Inflammatory cells are attached and moved to the site of injury. It is due to the chemical substances. Phagocytosis. In this process, the microorganisms and other injurious agents are engulfed and destroyed by the inflammatory cells.